Commissioners meeting to order.
Great. Thank you, Karn. I want to start today. I'm going to turn it over to Amy and ask her to provide just a quick overview of where we are today, as well as an overview of what is level 3, what's the timing of level 3. I know she provided a bunch of this information at the town hall this morning, and there was some confusing information again back and forth between the state around some timing stuff. So I figured we'll take this opportunity as our list of participants grows to be able to share that info again. And so, Amy, I'll turn it over to you.
Thanks, Scott. So first, I'll just share.
Wait a minute. One quick item. Happy birthday, Amy Wineland.
Thank you, Scott. Thank you, everybody. Thank you so much.
Happy birthday.
Thank you.
To you. Happy birthday to you.
So everybody be nice to Amy.
Happy birthday.
Amy Wineland. Happy birthday to you.
Thank you. Thank you.
Yeah.
Don't quit your day job there, Tom. You are quitting your day job. That's so sad. So here we are on the dial. We actually did see a slight drop. We're at 1,068 cases now, still way, way beyond what the threshold is for the severe level red that we have been moved into by the state. Long way to go to get back to that level orange, but positive news is that our percent positivity rate continues to drop. I think I'd like to share also what it looks like on our own webpage. People are noticing that we are starting to see a little bit of a dip. Here's our positivity rate. Again, we're coming back down into that level orange, which is great. This is a direct result of our increased capabilities for testing in our community, and people are going to get tested when they have symptoms, which is great. We are encouraging everybody to get tested immediately. This helps us isolate people pretty quickly. And then the other thing is that we're starting to see a slight downward trend in our cases overall as well. This is too early to say right now whether this is going to be a sustained trend down. We just really need to be watching this over the next few days to see if that is the case. We had heard news yesterday from the state with new modeling that they were seeing possibly a slight decrease in cases across the state, but today they said that is not going to hold true. In fact, they are going to be reporting here, I believe at around 4 o'clock, that there are 6,000 new cases in the state. That's up almost by 2,000 from yesterday. So the trend continues across the state, and it's really alarming, and we continue to have capacity strains in our hospital system statewide as well. We've had 12 hospitalizations in the last 12 days here alone in Summit County. And so we are seeing that trend as well here. And then, of course, across the state now, deaths are increasing in an alarming rate. We know that hospitalizations and deaths trail exponential growth in cases, and that's playing out across the state, unfortunately. So level red, we will be moving into level red, as many other counties are across the state. Level red includes many more restrictions, unfortunately, but they're targeted restrictions, again, focused on the gatherings, specifically where we're seeing cases as well, and where the data shows transmission is occurring. So level red, we will be going locally into level red with all restrictions by Friday at 5 o'clock, with one exception. Locally in our own public health order, we are allowing restaurants to stay open with their capacity limits of level orange until 5 o'clock on Sunday. This exception was made because we knew that restaurants had already ordered their food for the weekend, and so we are allowing them to stay open until 5 o'clock on Sunday, and then their restrictions will be taking into effect on Sunday at 5. And that will be described in our local public health order, hopefully to come out tomorrow after today's discussion.
Great. Thanks, Amy. And that's where some of the confusion lies. Again, we were originally under the expectation from the state that we would be moving on Sunday. Then they put out information that it was on Friday. We talked again. We thought that we would then be able to extend to Sunday, but it was a limited extension to Sunday. So again, level red effective in Summit County at 5 p.m. tomorrow, Friday, with the exception of restaurants, which will be effective at 5 p.m. on Sunday. So just want to make sure that everybody's got that clear. So questions from the commissioners about, where we're at, level 3 question or level red questions that you'd like to put out there?
Lodging continues to be a question. So you want to go through those numbers?
Yeah, I can. Let me make this clear as well. So this is something that, again, it will either be somehow spelled out more clearly within our public health order, or as part of FAQs, or as both, as we refine that document. So currently, so as of today, as we still sit in level orange, and as our local public health order has not yet changed, the restriction on lodging is tied back to personal gatherings and that restriction. And so it is up to 10 people from 2 different households. As of tomorrow, Friday, when we move to level red, the gathering rules have changed, or will change under that dial, and they will change to none. That means that you cannot gather with anybody other than your own household, which means folks that you reside with. And so that is the occupancy limitation that exists for your home, for short-term rentals, for lodging. And so that is the lodging restriction that will be in place as of tomorrow at 5 p.m. Your own household is all that you're allowed to have. There isn't a number limit associated with that, but in most cases, that number is going to be small, as it, again, is limited to those folks with whom you reside. And so I hope that helps to clarify that. We can certainly talk more about that, but that is the restriction that will be in place as a result of our move to level red. Other questions or comments with regards to that?
Well, that just makes it consistent in terms of who you can have in your home and who you can have in a rental.
Correct. Yeah, go ahead, Elizabeth.
So are we just talking about lodging in this part, or are we going to talk about it later too?
We can certainly talk about it now, or we can talk about it in an executive session. We've got some other public health order conversations that are going to take place in an executive session. But again, whatever you'd like to cover, if you feel it's appropriate.
Yeah, I think it's worth us talking about lodging right now and just explaining, sure, I think, the extenuating circumstances. And sorry, Amy, if this is a repeat from what you went over this morning, but there's not an opportunity, I don't think legally, for us to really differentiate different types of short-term lodging in Summit County. For example, if we were to say limit occupancy at a traditional hotel or motel style service, we can't do that in the same way at short-term rentals. And I just want to talk about that for our community, since we do have a lot of people on, that I think once I've explained this or spoken with this to different people, they're like, oh, we are in a different situation. So we have, let's just take a unit in Wilderness, for example, unincorporated Summit County, very popular place for short-term rentals. You have unit number 1 that's owned by a family and they rent it out on Airbnb. And you have unit 2 owned by a different person and they rent it out on VRBO. We as the county how would we ever be able to choose between who can rent on unit 1 or unit 2 if we were going to try to say reduce our STR rentals? If we were to say cut STRs in half, 50%, We can't do that because we can't go choosing between different people at this point who can and can't rent their unit. And so instead, we're going to have to rely on these other tools of reducing the households, the number of people there. And so this will just be one household right now. I think it is a good tool. I also want to say thank you to the many property management, professionally managed companies that I've spoken with over the last day. They've all really been providing good info that we can understand. There's a very, very large property management company in Keystone, and they were seeing about 57% occupancy around Thanksgiving. And so that would mean out of all the units that they rent, nearly 60% of them were going to be rented out during Thanksgiving week. Since then, they're seeing cancellations at a 24% rate. And that was just a few minutes ago. And so they are hearing from a lot of people that are canceling because of the change with just one household. In addition, people are canceling because of areas of where they're coming from, if the virus has been spreading, as well as just looking what's happening here. And I don't think anyone is going out saying, sign me up to have the virus. And people are trying to make those decisions in what's safe for their families. The CDC today said, please don't travel for Thanksgiving. And so we're hoping that people will follow that. We know that's not the case. We also know that during a holiday, this is going to be time where second homeowners are going to be using their own homes. So everyone you might see at that short-term rental, it could very well be the homeowner that's there visiting. Maybe they rent it out other times, but during holidays, they plan to use it. So there have been cancellations. I would say it's equal across the board from both Breckenridge, Keystone, et cetera, hearing about cancellation rates that are dropping. But we know our community is asking for something to change in terms of short-term rentals. And I think that what the state has put out for one household is certainly going to help us get to that.
Yeah, good points, Elizabeth. It's very similar to some of the info that I've been hearing as well. I think one of the big confusion points is not understanding what that one household means, or not understanding that that one household applies to short-term rentals. And so we want to make sure that folks understand that. I think the big property management organizations are getting a more complete understanding of that. But we'll, again, in whatever messaging we end up putting out, we'll make certain that that's, again, a high priority item for folks to understand, because it's not as obvious as lodging is at 50% capacity or whatever it might be. And so it's a little bit more complicated than that. So it's good to get the word out.
Yeah, I did hear also from one company that as soon as the public health order language is out, they're going to be sending out a message to all of their reservations. This is the new specific language, and then they expect to receive a large number of cancellations after that.
Yep, absolutely.
But we do need our short-term rental, and this is even individual owners. We need them to get that message out. We can't do it alone. It's impossible for us to message out to visitors coming from different states. I mean, we're not like a sophisticated marketing company in that way. And so we need those short-term rental companies to do the right thing and message out, these are the restrictions in Summit County.
Yep. And we did talk a little bit with the towns earlier today. I know at least a couple of them are working on some materials. We talked about sharing those materials with one another, trying to make it consistent so that the message we send out to unincorporated Summit County folks through our permit holder list is the same as the message that's going to go out from Breckenridge to their short-term rental owners and Frisco, et cetera. So we're going to work closely with them to try to make sure, again, that message is short and sweet and simple and consistent across the county as well. Other questions, comments related to lodging at all?
Well, I just want to acknowledge that this is really hard on a lot of businesses, and we are all very aware of that, and everybody's having to sacrifice just so that we can hopefully get to our peak ski season and be out of this red zone.
Yep, absolutely. I think we've mentioned the fact that there's some funding that we've received very recently that will be identified for some level of relief within the community. We have had some conversations with the towns. We're talking about trying to identify a group that can get pulled together quickly and discuss very quickly the types of relief that would be most beneficial within the community, how we might distribute those dollars. And the towns have said that they would like to be a party to those conversations, and that in some cases they may have funding that they would put into the mix, and we would be able to pool some resources. We've also talked about, again, there seems to be a fair amount of dollars available at the state level from the original relief funding that has not yet been distributed. And we're trying to figure out if there's any way for us to access those dollars to further bump up the amount of money that might be available here locally. And so we'll have, I'm sure, a bunch more conversations with regards to that.
Yeah, can I just add a little bit to that and just say that we're just hearing all day and real consistently that people in our community are scared and they're frustrated, and they are scared of the virus, and they're scared of what's going to happen with the economy and how they're going to feed their families and themselves and pay their rent and stay in their homes. And we hear those comments and we care about them. And these are really, really difficult times for people in our community. And so we are doing our best to connect people with resources. But I think it's as important as to acknowledge as it is to share what the new rules and guidelines will be. And we'll continue to do our best to support the community in any way we can.
There are a couple of questions in the chat. I'm just going to quickly try to respond to at least this last one that is related to lodging, which we just talked about. So there's questions about, the question is about what household means again. And so the idea around household is folks that are residing together are considered your household. So if you are not living with people, they may be related to you, but they are not living with you. They are not part of your household. The intent around this restriction is to limit the amount of interactions individual households have with one another. So we don't have multiple households mixing, so that we don't have as much opportunity for the virus to spread. And so, again, there's also questions in there with regards to grandfathering and what if you already had a reservation. Again, unfortunately, and we've talked about this in some other discussions, there is no grandfathering for the public health order. So the public health order applies when it's effective and until it is changed or removed entirely. And so there may be, and I'm sure there are, a number of reservations within our community, a number of folks that had intended to go to a restaurant for a sit-down Thanksgiving dinner, whatever it might be. Based on the new public health order, restaurants are closed for in-person dining, except for some limited outdoor dining until 8 o'clock. And short-term rentals and other venues are closed for personal gatherings effective Friday at 5 p.m. So if there are reservations for this weekend for folks that are not in the same household, those reservations are in violation of the public health order, or will be in violation of the public health order. Let's see. I don't know that we can necessarily go through all of the questions here. There isn't, I think what we'll do is we'll try to capture those questions. AP, I'd ask you or Sarah to make sure that we capture all the questions that are in the chat. We know that some of this information is new to people, and we know that some of this information is can be confusing. And even once we put out a public health order, those are not always the most easily digestible documents. There's a lot of reference back to this set of guidance or this state order or whatever it might be. So we are working to develop a frequently asked questions packet as well that would go along with the public health order. And so we'll try to capture these questions. We'll try to answer those that are maybe one-offs, but also those things that are the more common questions, so that folks can reference that information. And we will, again, tie those things together with the public health order so that folks can get that information as well. Other questions, comments from staff or from commissioners?
Scott, as we do have questions in the community, which phone number do they use to get clarification?
Yeah, it's really, email is probably the best alternative. Sarah, COVID questions, we can put it in the chat as well, but I don't want to say it wrong. So Sarah or somebody else want to read off what it actually is?
Yeah, it's COVID questions at summitcountyco.gov, but I'll put it in the chat. Oh, Hannah just did it. Hey Scott, I don't know. I've had this call on this question on a number of the meetings today about college students who live here, the colleges are closing. Do you want to address that, Amy? And whether if a college student is a local here to Summit County and their school shuts down, how will they be treated in terms of the definition of household?
Yeah, I mean, they are still dependents of their parents, so that would be included in their household.
Okay.
Amy, another question that we've gotten a couple of times lately is about how household childcare situations work. Can you clarify that one?
Yes, so child cares are able to continue functioning. They are an essential service for our community and our workforce. Friends, family, and neighbor care are also included under that critical workforce definition. So this is unlicensed home providers who are caring for maybe their friends or their neighbors' children, and that can continue to function as it is.
Of course, we're getting some questions with regards to enforcement. We're getting some questions with regards to just general non-compliance, concerns about whether that's locals or visitors. I suspect that we have both locals that are not complying with our restrictions, and we also have, of course, out-of-towners, guests and visitors that are not complying with the restrictions. We have asked, and we will continue to ask folks to report those situations where they see a violation taking place, so that we can act upon it. Again, that number is 970-668-8600, where people can report violations that they see. We are and have increased the level of enforcement and our capacity to do additional enforcement. It really is important for folks to comply with these restrictions. Number one, because we want to make sure that we can control the spread of this virus and reduce the amount of folks that end up with severe illness, end up hospitalized, or end up dying as a result of this virus within our community. We also want to be able to control the spread so that we can have a more normal winter season and a more normal economic level of economic activity within the community. And so all of those things are under our control. If we follow the restrictions, if we follow or we practice the 6 commitments to containment that we've been preaching about since this summer, then we do have a real opportunity to bring the numbers back in line, to reduce to change the trend line so that it's bending in the right direction, and get back to a situation where we can reopen certain aspects of the economy that we are very disappointed and devastated to have to make a change to at this point in time. But we are doing what we can to try to identify those areas that are the most likely to cause spread within our community, rather than shutting everything down on a widespread basis. And so we ask everybody, whether you are a local or you are a visitor or you are a property manager that is responsible for visitors that are coming in, or a short-term rental owner or a business owner, to please follow the restrictions that we've put into place so that we can have an opportunity to bend this curve in the right direction and keep it there. Other items that folks would like to raise during open session, I do have a couple of items for an executive session as well. All right. Hearing none, then I would recommend that we move into an executive session to discuss confidential public health matters, including information related to individual cases, outbreaks, and negotiations, and to receive legal advice.
Sorry, a little slow there. 24/6/4024 B, C, and D, as well as E, with particular reference to 25/1/122 CRS.
So
I was going to say it's unlikely that we would come back to this room, or unlikely there'd be any action to be taken.
so moved.
Second.
We have a motion and a second to go into executive session. All in favor, say aye.
Aye.
All right, so we will leave this room, and again, if there is any action taken by the Board of Health, then we will return to this room. And we will, again, not shut this meeting down so that we can capture the questions that are coming in. And again, we'll make sure that we try to respond to those via our FAQs.